My name is Shashi Raja. I'm a board-certified internist who has been in practice for about 10 years. I'm part of the multidisciplinary committee on the lung team at the Cancer Center. My philosophy in treating patients is I'm not just treating a patient, I'm treating them as an individual with the needs, their families, their current state of living. So I'm addressing all the things, and to make it happen and the patient feel comfortable with the doctor and their treatment, what's going to happen to them, what they can see, how the treatment is going to go through. They're going to have some complications, or if it doesn't work, what next is there for them to go through. And to have the patient involved in the care along with me and have them know what they're going through and make them comfortable and be an educated patient. That's my whole goal and philosophy. The most rewarding part of my job is, I go into work, I see the patients, I go through the day. At the end of the day, the patients come back, or they call you maybe like 3 months down the road. They have not seen you, but they come back and say, doctor, you saw us 3 months ago, you took care of us in the hospital, we went home, we're sorry we couldn't follow up with you, but we're doing great, we'll come and visit you. And you have supported them through these phases, and even when they're very acutely sick in ICU, you take care of them, and then they end up going home, walking home. And when they're going, they smile at you and say thank you. That's the best part. The uniqueness of the Steeplechase Cancer Center comes from it being situated in a community hospital where you have, your neighbor could be working there, your primary care doctor who's managing everything is a part of the cancer center. And if you have a question, you feel like you're talking to somebody who knows you, then it's just a name on the other end of the telephone. It's a person who's talking to you. And the good thing for me, being an internist who sends the patients there, is that I have a question, I can reach out to the specialists. I can call them and I get them the same day, within minutes, and sometimes when it is an emergency, it's like they take the calls and they're there. So that's what makes it more unique for me. At our Lung Cancer Institute, it's patient-centered. It's where all the specialists come to the patient, than the patient having to go from specialist to specialist, carrying his files and folders and the pictures. It's all together. So we are basically doing a patient-centered approach here, and that's what makes our institute very unique.